Hello, everyone. Welcome to Endwell Live, where each week we're having a conversation with a special guest about how, in this truly unprecedented time of crisis, we can collectively find community and best support those facing serious illness, support caregivers, and families. I am Shoshana Ungerleider, a physician and the founder of Endwell, where we're focused on making the end of life a part of life. And I hope that you're all safe and healthy. And if not healthy, I hope that you're on the mend. We're coming to you today to find community in one another and support our physical and our emotional health through this virtual conversation. And today, I have the pleasure of speaking with my dear friend, Dr. Anthony Bach, who is co-founder of VitalTalk and co-director of the University of Washington Center for Excellence in Palliative Care. He's also an author, an app developer, and an all-around just amazing person. We invite you to share this link on your own page so that others can join the conversation. And thank you to the Cambia Health Foundation and the Tauber Family Foundation for their support of this program. So hi, Tony.
Hello, Shoshana. How are you?
I'm good. How are you doing with all this?
I am doing okay. Thank you for asking. I'm safe and healthy, and I'm in Seattle today. So, and it does seem like we're in a new place with the pandemic now. You know, the caseload is lower, and it's not quite the same as when nobody knew how high it would peak. So things are a little better.
Although, yeah, same here in San Francisco, although who knows what the future holds, right? We can really hope for the best here, but it's an evolving situation, I would say, week by week.
Totally.
So you co-authored a book, Mastering Communication with Seriously Ill Patients, released the first iPhone app for clinician communication skills, and then authored the online communication skills curriculum with VitalTalk, offered through the Center to Advance Palliative Care.
Yeah.
How do communication skills enhance a clinician's ability to respond to a crisis like COVID-19?
Yeah, it's a great question. Well, you know, what I am seeing is that even though many of the circumstances are totally different now, you know, we're doing all these things over Zoom. You know, there are times when a family member can't come into a room, depending on, you know, where they're located. We are seeing, we're counseling patients about an illness that we don't know all the details about, you know, in a way we're still learning about it. And yet, even despite all those, you know, contextual things that are different, the core of what we do as, you know, doctors, nurses, other clinicians who work with serious illness, I mean, the core of it is actually the same. And we can rely on the same principles that we have always known about, that we've developed over the past, we and others have developed over the past, you know, 20 years, that can help all of us, whether we're clinicians or family members or other just concerned people, that can help us know how to improvise. And so, for example, as an example, one of the things that we've really stressed is paying attention to kind of the emotional tone of the other person, because, you know, we've learned from the research that emotions are faster than, you know, rational thinking, that emotions, if they're really strong, that they block out our ability to take in new information. And so we can do all of that even when we're wearing PPE, even when we're on the phone, even through Zoom. And so that's why we wrote that COVID ready communication guide, because we wanted to emphasize for a whole wide group of clinicians, much larger than palliative care, who are involved with these patients, you know, here's what you can do, because it's so easy to be feel paralyzed with what you can't do right now.
Yeah. Oh my goodness. And it sounds like, from talking to the folks at CAPC, that thousands and thousands of people have downloaded this guide. I mean, you've created a way for so many people to tap into a resource that is so critical right now. It's wonderful.
Well, thank you. I mean, it's been kind of amazing, actually. I mean, we kind of threw it together as a, like, here in Seattle, it's happening. We need to do something, right? And what really got me going was when I heard of the first critical care doctor who got COVID himself and was intubated in an ICU. I was like, wow, this is real. We're going to have to really do this. And so we put it together and we first published it as a Google Doc. And
I remember, I saw that. Yeah.
all these people, all these doctors like translated as volunteers, and now it's in 20 languages. You can download it from our website in 20 languages. It's wild. But what I think it speaks to is, the core of the people we work with, they want to pitch in and help, and they're willing to do what they think is the right thing, right? They're willing to like put their own time and sweat into it. And, I think it really says a lot about our clinician community around the world. Because, and I feel like this whole pandemic is connecting us as people around the world who want to make serious illness better.
Yeah.
Yeah.
I mean, I think across disciplines, you have just seen how in the midst of this incredible crisis, people have really come forward to jump in and help on any number of things. It's just really, really amazing to see that happen. And so quickly, people
Yeah.
just willing to really jump in a matter of days, come up with something it's really wonderful, and then get it out there to the world.
I think it's really about the leadership that's needed now, is really about responding to the moment and taking action no matter what level you're at. You might, I know hospital chaplains who have been leading the way with conversations. I know, heads of hospitals who've been leading in different things. And I do think it means that we all have to step back from our hierarchies, and go, what's needed right here for this patient now in my work?
Absolutely. So I know that you're boarded in hospice and palliative medicine, in medical oncology, and general internal medicine. That's like being a one-man band for breaking down the silos in medicine. It's awesome. Can you share with us a bit about how these specialties intersect and how they might learn from each other?
Yeah, well, so I do think, especially if I take like oncology and palliative medicine, they do, exemplify different poles of where clinical medicine is now. There's the technological side, all the stuff that we can do, all the scientific advances and how those play right into how we can change the course of an illness, change the natural history of an illness. And on the other side, there's palliative medicine, which is really about quality of life and how can we help people live well, even in the face of a serious illness. And so I think each of those specialties has different emphases. Palliative medicine emphasis is on the quality of life side. Medical oncology, the emphasis is on the intervention side. And yet both of them have their other part. Medical oncology, there are a lot of medical oncologists who really care about how their patients are living and how, their quality of life. And, palliative care, there's a whole bunch of those physicians who are super into the nerdy details of symptom control and, system management and stuff like that. So I think the issue about, breaking up the silos that you mentioned, how can we break them down and learn from each other? I think we have to, as clinicians and specialists in different ways, we have to learn to step back from these problems and see how they cut across all the existing borders of what we considered our stuff or our turf or their turf. And I think COVID is showing us, I feel like there's a new lesson every day, right? Like first it was about what are we doing literally in the ICU about ventilating people and about how do we talk to their families, right? Now it's about what's happening in underserved communities as it becomes clear that underserved communities are hit so much harder, and the reasons they're like a distilled textbook of all the other kind of social determinant issues that we're facing in terms of healthcare for our country. And so I think it's one of those moments where we have to step back and go, whoa, this is showing us the big picture that we don't always see. And what would it take if we built the team that we need to build now, right, to tackle this? Not the team that our hospital evolved or my academic medical center evolved over, 30 years. What's the team right now? And I think that's part of what I see happening in a good way. And that's what I think could happen. I feel like we're inventing the future of medicine right now. Like the stuff that we're doing right now in our hospitals, the good part of it will could stick for the next 20 years. And so I think it's really important for us to look at what's happening in that light. Um, you know?
Yeah, I sure hope so. I think that the amount of collaboration alongside, innovation that's happening is really quite inspiring in the
It's
face of all
super
this. And
cool.
I do hope that it sticks around, right? I think
I
that'd be
know.
fantastic.
There were things that happened in the HIV era that are still with us now that are so important, like, accelerated approval from remdesivir. That
Hmm.
happened in the AIDS era. Patients on study sections who were involved in policy making, that started in the HIV era, right? Like even palliative care. Like I don't think we'd be here with this new specialty without what happened in at the peak of the AIDS crisis. So
Oh,
there
yeah.
really is something about that, right? So I think the same thing is going to happen right now, and we just have to keep our eyes open and think of all these innovations in that really adaptive way.
That's fascinating. I've never thought about palliative care in that context before. So,
Oh
yeah,
yeah.
it's a lot to think about.
Oh yeah. You know what? Hospice is one of the things that really pushed the development in hospice in the US was AIDS, right? All
Yeah.
the guys, and they were, those, it's like San Francisco, your hometown, like was the epicenter and the place where all these community groups got together and said, okay, we're going to take care of each other.
Hmm.
That was
Hmm. So, when I last heard you speak, you talked about your experience coming out as a gay man at a time when that was risky for a doctor to do. And now you're coming out, in a sense, as a proponent for more research on the use of psychedelic medicines.
yes.
So, I have two questions for you about that. The first is about what you're learning about psychedelic medicine's value for patients with
Yeah.
life-limiting illnesses.
Yes, yes. So, um, there have been in the news a small handful of well done studies that show great promise for the use of psychedelic assisted psychotherapy for people who have a life limiting illness. And, the group that's really compelling there is the group of people with cancer. And, as an oncologist, I can tell you, I have seen so many people who are terrified of what might happen to them as their cancer gets worse, that their whole world is just defined by fear, and they make decisions out of fear. And I've had patients say, you know what, I know this is probably not the best decision to make, but I can't do otherwise. And then they end up, uh, having an end of life that is not the one that they really would have wanted to have. And so that I've really thought about that a lot. It's really one of the things that's kept me in this work on communication. And I think this new modality really has some potential. You mentioned coming out, and I'll just say for listeners who didn't know, I had a psychedelic journey myself and wrote about it in the Journal of Palliative Medicine. And so as far as I know, it's the only account by a doctor of a psychedelic assisted psychotherapy experience that was done with the idea of thinking, what could this bring to our patients? And I think there is something really powerful about it. It gives you this opportunity to step out of yourself and think about your life and what you're worried about and what you really care about in a much bigger way. And with a good psychotherapist at your side, you can do a tremendous amount of psychological work in a short time. I mean, it's still a lot of work. It's not like
Hmm.
you just take the pill and you're better. But I think it's a new modality, and so I'm very interested in seeing, you know, what happens when it's more available for people with a life-limiting illness. And actually, in this time of COVID, actually, the study I'd really like to do now is a study of psychedelic assisted psychotherapy for clinicians who are traumatized by their work with COVID and dying people. Um, because I think the burden on clinicians is pretty significant, and I
Yeah,
actually think it's going to be big. Like
yeah,
we're going to be seeing this for years, right?
I agree.
And so I think we should really explore this in a way that is responsible and safe, that kind of allows us to put that some of that baggage from the 60s in the past. Like we have to really do this in a responsible way. And I think totally possible. I think it'll take a bunch of us clinicians who collaborate with, the clinical trial experts and the people who help drugs get regulated and approved. And I think we just all have to get together and figure out, like, how can we figure out if this is really good for a group of patients, and then, how does it help them? How does it fit into our current group of interventions for people who are, really facing big time anxiety and distress from, their serious illness. So,
Yeah.
yeah, totally.
Wow. I love that idea. So my second question is about being yourself, even when it's risky. I think a lot of people are using this time right now to get in touch with their authentic selves, or at least that's what they say they're doing. Do you have any advice or thoughts on just this small question of how to live one's truth?
Yeah, well, so, I think that uh, like, first, I agree with you that people are like, well, what is my authentic self? What do I really care about? And I do think it's like the earth is giving us all a wake-up call.
Mhm.
My Zen teacher, Joan Halifax, talks about it like we're in this kind of global rite of passage. And the first part, the rites of passages have three parts, right? And they were described by this anthropologist, a Dutch anthropologist, like, before the turn of the century, named Arnold van Gennep. And he had studied all these indigenous societies and said, all these big moments in your life are marked by these rites of passage. And the first part of the rite of passage is called separation, where you're separated from your everyday life, all the everyday concerns you had, which is like what's happening to us right now, right? We're separated. Then there's this kind of middle, disorganized, starting to be reorganized, chaotic period. And I think that's kind of what we're going into now. Like, everyone's going to sit back and go, well, what does this all mean to me? What does this mean about how I should live, and what I should work on, and right, how I should treat everybody? And then the third phase is called reincorporation or reintegration, where you take what you understood in that, separation and reorganization, and bring it back into your real life. And so I think that's what I would want people to know, that it's okay to feel a little bit disorganized and chaotic now. Like, that is the marker in some ways that we're really undergoing something big. And so not to be worried that they won't come out of it, or that they'll be out of control. Like, this is something that humans have been doing since, like, the beginning of civilization. Are these huge, there these moments for huge shifts. And so I think what we have to do as a culture is we all have to be ready to hold space for each other and support each other while we're with this, and make sure that we give all the people we love and the people that we work with, what they need to kind of work that out. Because I think we're going to be working on this one for a while.
Yeah.
Yeah.
Wow. You're giving me a whole lot to think about. Um, and and Tony, what are you as we look toward the future here,
Yeah.
as we are, what is bringing you hope right now?
Oh, what is bringing me hope? Well, you know what? The thing that I really feel hopeful about is the amount of creativity and ingenuity that is happening right now. You know, I get that there's all this stuff about, oh, everything's, a mess. The politics are horrible. Blah blah blah. And yet I see these other signs of new ways of thinking about, what our economic system should be like, about what our healthcare system could be like, about how we handle and hold people with a serious illness. Actually, one of the things that fascinates me, for example, is this whole thing about honestly, the amount of heartbreak that has happened from people not being able to be, with someone who is dying. And I think what it's telling us is, we kind of took it for granted before, but actually it's super important. It's like irreplaceable. And I don't think we had that kind of clear consciousness before, right? And could we use that to say, we need to make sure that those moments when they can happen again really happen. Like, we can't afford to take them for granted. We shouldn't be saying, well, maybe it can happen when, you know, the team's done with the room and the team's finished rounding and the nurse is finished, you know, doing their stuff and blah, blah, blah. I mean, maybe that should be at the center of what happens. And we could reorganize things around that. So that's the thing that's giving me hope is there is a tremendous amount of ingenuity out there. And like even the fact that we're doing this online, like I have seen more talks by people that I would have never been able to have access to. And it's really just really enlivening and really super cool. So
Yeah,
that's why I really appreciate being part of this. I feel like we're part of the new wave out there.
we are. That's right. Wow, Tony, thank you. This has been a fantastic conversation. And folks out there, we want to hear from you. How has coronavirus changed how you feel about prepare for serious illness, for caregiving, or the end of life experience? Please go to endwellproject.org/stories to share your story with us. And I want to thank Tony, Dr. Anthony Bach, for joining us today, and to all of you. It's communities and conversations like this that give me hope in these tough times. Stay
Yeah.
safe out there.